Vitamin D, often referred to as the sunshine vitamin, holds a pivotal role in human health. Beyond its well-known benefits for bone health, this fat-soluble nutrient is essential for immune function, cellular growth, and the maintenance of inflammatory responses. Its significance has been magnified in recent years as researchers continue to explore its influence on overall well-being and resilience against infections. Vitamin D is unique compared to other vitamins because it can be synthesized by the body through exposure to sunlight. This natural production occurs when ultraviolet B, UVB, rays from sunlight trigger the conversion of a cholesterol-derived precursor in the skin to vitamin D. From there, it undergoes further transformations within the body to become biologically active. In addition to sunlight, vitamin D can be obtained through dietary sources, although these are relatively limited. Fatty fish such as salmon and mackerel, fortified foods like milk and cereals, and egg yolks are among the richest sources. However, these foods often fail to provide sufficient amounts to meet daily requirements, especially in regions with limited sunlight or during the winter months. The primary role of vitamin D has traditionally been linked to calcium absorption and bone health. Without adequate levels, the body struggles to maintain bone density, leading to conditions such as rickets in children and osteomalacia in adults. However, its influence extends far beyond the skeletal system. One of the most critical roles of vitamin D is its contribution to the immune system. It is a key regulator of immune responses, particularly in activating T lymphocytes, the cells responsible for targeting and neutralizing harmful pathogens. These immune cells depend on vitamin D to function effectively, making adequate levels of the nutrient essential for a robust defense against infections. Once vitamin D is absorbed from sunlight or food, it enters the bloodstream and is transported to the liver. Here, it undergoes a process called hydroxylation, where it is converted into calcifidiol, also known as 25-hydroxyvitamin D. Calcifidiol serves as a circulating reservoir of vitamin D and is the form most commonly measured in blood tests to assess vitamin D status. When the body requires active vitamin D, calcifidiol is further hydroxylated in the kidneys to form calcitriol, the biologically active version. This active form interacts with receptors in various tissues, facilitating processes such as calcium absorption in the gut, modulation of immune cells, and regulation of inflammatory responses. Calcifidiol is not merely a passive storage form of vitamin D. Its presence in the bloodstream is critical for ensuring a readily available supply that can be rapidly converted to calcitriol when needed. This rapid activation becomes particularly vital during times of immune stress, such as infections or injuries, where the body's demand for vitamin D spikes. By acting as a reservoir, calcifidiol allows the body to maintain flexibility in its use of vitamin D, balancing the immediate needs of active processes with the long-term maintenance of systemic health. Despite its importance, vitamin D deficiency remains a global health issue. Factors such as limited sun exposure, darker skin pigmentation, obesity, and certain medical conditions can impair the body's ability to produce or utilize vitamin D. Inadequate dietary intake further exacerbates this issue, especially in populations with limited access to fortified foods. The consequences of deficiency are profound. Beyond weakened bones, low vitamin D levels have been linked to an increased risk of infections, autoimmune diseases, and even chronic conditions such as cardiovascular disease and diabetes. During illness, deficiency may impair the body's ability to mount an effective immune response, leading to worse outcomes. In recent years, researchers have investigated the role of vitamin D supplementation in critical illness and recovery. While early studies suggested that high doses of vitamin D might enhance immune function during infections, subsequent research has revealed a more nuanced picture. Administering vitamin D to patients during the acute phase of critical illness has shown limited benefits in many cases. This may be because the body requires time to convert supplemental vitamin D into its active forms, a process that might not occur quickly enough to influence outcomes during the short window of critical care. The timing of supplementation is therefore critical. Ensuring adequate vitamin D levels before the onset of illness appears to be far more effective in supporting immune resilience. Individuals with optimal vitamin D levels are better equipped to mount a rapid and effective immune response, reducing the severity and duration of infections. Given the challenges of deficiency and the limitations of supplementation during illness, maintaining sufficient vitamin D levels year-round is a proactive approach to health. While sunlight remains the most efficient source of vitamin D, incorporating dietary sources can help bridge the gap. Fatty fish such as salmon, tuna, and mackerel are excellent options, providing both vitamin D and omega-3 fatty acids, which also support immune health. Fortified foods, including milk, orange juice, and cereals, are valuable additions, particularly for those with limited sun exposure. Egg yolks and mushrooms exposed to UV light can also contribute to daily vitamin D intake, although their levels are comparatively lower. Combining these foods with healthy fats can enhance absorption, as vitamin D is fat-soluble. Sunlight exposure is the most natural way to boost vitamin D levels. Spending 15 to 30 minutes outdoors several times a week, with skin exposed to direct sunlight, can significantly increase vitamin D synthesis. The amount of time needed depends on factors such as skin type, geographic location, and the time of day. It is important to balance sun exposure with skin protection to reduce the risk of damage and long-term effects such as skin cancer. Using sunscreen after sufficient exposure or focusing on early morning or late afternoon sun can mitigate these risks. For many individuals, dietary sources and sunlight alone may not provide adequate vitamin D. Supplementation offers a convenient and effective solution, particularly for those at higher risk of deficiency, such as older adults, individuals with limited outdoor activities, or those living in northern latitudes. When choosing a supplement, healthcare professionals often recommend vitamin D3, cholecalciferol, which is more effective at raising blood levels than vitamin D2. The appropriate dosage depends on individual needs and baseline levels, highlighting the importance of personalized guidance. Monitoring blood levels of calcifediol provides valuable insights into vitamin D status. Regular testing can help identify deficiencies early and guide adjustments in diet, supplementation, or lifestyle habits. The generally accepted optimal range for 25-hydroxyvitamin D is above 30 ng/ml, though some experts advocate for higher levels to maximize health benefits. Addressing vitamin D deficiency has implications that extend beyond individual health. On a population level, ensuring widespread access to fortified foods, public education about the importance of sunlight exposure, and affordable supplementation can reduce the burden of deficiency-related diseases. In healthcare settings, incorporating routine vitamin D testing and supplementation into preventive care can improve outcomes for at-risk populations. Special attention should be given to vulnerable groups, including older adults, individuals with chronic illnesses, and those living in regions with limited sunlight. As research continues to uncover the multifaceted roles of vitamin D in health and disease, the importance of maintaining adequate levels becomes increasingly clear. While supplementation during illness has shown mixed results, the evidence overwhelmingly supports the benefits of proactive measures to prevent deficiency. By prioritizing dietary diversity, mindful sunlight exposure, and personalized supplementation, individuals can optimize their vitamin D status and enhance their overall health. For public health systems, addressing the widespread issue of deficiency represents a cost-effective strategy to reduce disease burden and improve quality of life. In the broader context of wellness, vitamin D serves as a reminder of the interconnectedness of lifestyle choices, environmental factors, and nutritional strategies in achieving lasting health. Vitamin D is more than just a vitamin, it's a cornerstone of your health and immunity. From supporting your immune system to promoting bone strength and overall well-being, ensuring optimal levels can transform your quality of life. Remember, a healthy balance of sunlight, diet, and supplementation is key. If you found this video helpful, don't forget to hit the like button, share it with someone who could benefit, and subscribe for more insights on health and wellness. Stay proactive, stay healthy, and we'll see you in the next video.